Now, generally speaking, when we hear about immunotherapy, what's being referenced is what are called checkpoint inhibitors. These are antibodies that target key proteins on immune cells to allow them to then destroy the tumor. Now, immunotherapy using checkpoint inhibitors has completely revolutionized the treatment of many cancers and actually resulted in the Nobel Prize being awarded to Jim Allison and Tasuku Honjo back in 2018. Checkpoint molecules are extremely important because they shut off the immune response, which can be critical in preventing any type of autoimmune disease. Now, obviously, in the context of cancer, we don't want to shut off the immune system, but tumors find ways to exploit these strategies to turn off the immune system and continue to grow. So these checkpoint inhibitors block access to these proteins on immune cells and leave the tumor unable to shut off the immune system. The classical analogy that's always used is of the immune system as a vehicle and the checkpoint molecules as the brake. Now, tumors are able to apply the brake on the immune system, and this allows the tumors to grow unchecked. But with these checkpoint inhibitors, the tumors no longer have access to the brake, which allows the immune system to remain active and destroy the cancer. Now, with RET fusions, the success of checkpoint inhibitors has been quite limited, and this may be because of a few reasons. First, tumors with RET fusions tend to have low levels of immune cells, which means that checkpoint inhibitors don't have as many cells that they can act upon. Second, RET tumors don't have as much or any PD-L1 protein, which is the target of checkpoint inhibitors. And lastly, RET tumors have a very low tumor mutational burden. Now, as tumors grow, they make many mistakes in replicating their DNA, and whereas these mistakes would usually be fixed in a healthy cell, the tumor is unable to fix them, which leads to an accumulation of what are called mutations. And these mutations are critical because they tend to make tumors much more visible to the immune system. So in the absence of these mutations, even if you reactivate the immune system with checkpoint inhibitors, the immune system is not effectively able to see the tumor, making these therapies less effective in this setting. And this is also the case for other tumor types, including EGFR mutant, HER2 mutant lung cancers, as well as ALK fusions, among others. And so this requires a different type of strategy.